How to use the on-body infuser for FUROSCIX. This video is a summary of the instructions for use. It is not intended to replace your full review of the instructions for use, which describes how to use FUROSCIX on-body infuser with pre-filled cartridge. Always read the instructions for use prior to using the on-body infuser for FUROSCIX. FUROSCIX, furosemide injection for subcutaneous use, is indicated for the treatment of edema, for example, congestion, fluid overload, or hypervolemia in adult patients with chronic heart failure or chronic kidney disease, including the nephrotic syndrome. You should notice an increase in urine production an hour after the infusion is started and may need to make frequent bathroom visits. Wash your hands before using the on-body infuser. Do not use the infuser if the expiration date has passed. Open the carton and remove the contents. Do not use the on-body infuser or pre-filled cartridge if the packaging or any content appears to have been previously opened or damaged. Do not fully open the cartridge holder or touch the blue start button until you are ready to begin the infusion. The liquid in the pre-filled cartridge should be clear to slightly yellow. If discolored or cloudy, the patient is advised not to use and to contact their healthcare provider. Clean the tip of the pre-filled cartridge with an alcohol wipe. Fully open the cartridge holder and insert the pre-filled cartridge. Once the cartridge holder is fully open, the infusion must start within 30 minutes or the infuser will not function. Close the cartridge holder all the way until it is even with the rest of the on-body infuser. Select a hairless application site on the stomach, on either side of the navel where there are no skin folds or irritated skin. The site should be a flat area below the rib cage and above the belt line. Rotate the application site every day if instructed to repeat the dose. Wipe the application site with an alcohol wipe and allow the area to dry. Peel away the white adhesive liner by grasping the white tab and pulling it away from the blue adhesive backing. Do not pull the blue tab away from the device. Apply the on-body infuser to the chosen skin site while standing or sitting up straight. Do not bend over when applying the on-body infuser. The cartridge window should be facing upward. Press the on-body infuser firmly onto the skin and rub your fingers over the edges of the adhesive to get it to stick well. Firmly press and release the blue start button to start the infusion. The indicator light will blink green and the on-body infuser beeps, signifying the infusion has begun. Allow medicine to deliver for 5 hours and relax during the delivery period. Do not exercise or take part in activities that might result in the infuser getting wet or falling off. Limit bending movements. Take care not to bump the on-body infuser while wearing it. During the infusion, the indicator light will continue to blink periodically, signifying that the infusion is running. The infusion is complete and the on-body infuser is ready to be removed when the indicator light turns solid green and the on-body infuser beeps. Peel the on-body infuser off the skin. When removed, the indicator light will turn off, the needle cover will extend over the needle, and the infuser will turn off. Dispose the used on-body infuser for FUROSCIX and pre-filled cartridge together into an FDA-cleared sharps container. If the on-body infuser alarms during use, the indicator light blinks red and the infuser beeps, signaling an error or the infuser came off the skin. The patient is advised to stop using the on-body infuser, carefully remove it, and call their provider for further instructions. Important safety information. FUROSCIX is contraindicated in patients with anuria and in patients with a history of hypersensitivity to furosemide, any component of the FUROSCIX formulation, or medical adhesives. Furosemide may cause fluid, electrolyte, and metabolic abnormalities, particularly in patients receiving higher doses. patients with inadequate oral electrolyte intake, and in elderly patients. Serum electrolytes, CO2, BUN, creatinine, glucose, and uric acid should be monitored frequently during furosemide therapy. Excessive diuresis may cause dehydration and blood volume reduction with circulatory collapse and possibly vascular thrombosis and embolism, particularly in elderly patients. Furosemide can cause dehydration and azotemia. If increasing azotemia and oliguria occur during treatment of severe progressive renal disease, discontinue furosemide. Cases of tinnitus and reversible or irreversible hearing impairment and deafness have been reported with furosemide. Reports usually indicate that furosemide ototoxicity is associated with rapid injection, severe renal impairment, the use of higher than recommended doses, hypoproteinemia, or concomitant therapy with aminoglycoside antibiotics, ethacrynic acid, or other ototoxic drugs. In patients with severe symptoms of urinary retention because of bladder emptying disorders, prostatic hyperplasia, or urethral narrowing, the administration of furosemide can cause acute urinary retention related to increased production and retention of urine. These patients require careful monitoring, especially during the initial stages of treatment. Contact with water or other fluids and certain patient movements during treatment may cause the on-body infuser to prematurely terminate infusion. Ensure patients can detect and respond to alarms. The most common adverse reactions with FUROSCIX administration in clinical trials were site and skin reactions, including erythema, bruising, edema, and injection site pain. Please see the full prescribing information and instructions for use.